My name is Erin Jones, and I'm a neurologist in a private practice, but I also work out of hospitals as I'm needed. Many of my patients are referred to me from other physicians, while others come to me with symptoms of neurological problems. I feel that working in a private setting is more calming for the patients than being in an environment that they know as scary. One of the biggest cases that I've seen is bipolar disorder. In the past 97 patients, 32 of them have been diagnosed with being bipolar. Many of my patients experience a mania and a depression. When they experience the mania, they will be overly happy, extremely impulsive, easily distracted. But when they experience the depression, they will feel sad and hopeless and withdraw from people that they're close to or lose interest in things that they once enjoyed. And I usually prescribe them with antipsychotics and therapy, depending on how severe their symptoms are, depends on the amount of prescriptions that they'll need. And then I would rather try to regulate them through therapy than using medications. And one of my patients, we're going to refer to her as patient A, was diagnosed with bipolar disorder. She's a 28-year-old Caucasian female in middle class, and she was originally diagnosed with ADHD before her symptoms got more severe, because she started out as just having a bunch of energy and not being able to sleep, just not being able to focus because she was just overly energized. And so the previous doctor thought she had ADHD, while she only had the mania with no depression. And then eventually her symptoms got worse over time, and they became a lot more severe. And so her depression overruled her mania and prescribed her with antipsychotics and therapy 3 times a week due to her symptoms getting rapidly worse. And that's one of the worst cases that I've seen, but her symptoms started out different than other patients, and they worsened a lot faster. And then if a patient has severe symptoms, I believe that a more structured environment and a more structured schedule would be beneficial to them, so that they aren't just going about having different types of moods around them. And their symptoms of bipolar aren't very well known throughout people, just educationally, and so people aren't quite sure what to look for. So they need to be more aware, and in order to do that, we just need to get the word out about bipolar disorder, kind of like we do with other diseases. And we need to try to fix the disorder with therapy rather than prescribing medications, because some medications don't help very well due to the side effects that they have that can cause their brain to not react the way that we need their brain to react. So with therapy in a more structured environment, I've found that to help better with my patients than I have with some of the antipsychotics or antidepressant drugs, whereas the therapy has helped in increasing their therapy to more times in the week, or to sometimes group therapy helps them because their brain can understand more of what other bipolar people are going through, and it helps them to be able to know how to regulate their own brain and control the impulses that they're having, rather than letting the impulses take over and them not having as much control over it and not knowing what to do and depending on drugs to help them. Whereas if they're in these therapy groups, they can help themselves, and in that kind of structured environment, it can help them to understand that other people are going through the same thing that they are, rather than the antipsychotics trying to help them.